Good evening, Sri Lanka. Welcome to another episode of iMed. We're going to talk about something really critical in this country right now, not just in Sri Lanka. I guess it's a global phenomenon right now, the pandemic that's taken control of probably everything that happens around us. And we are getting used to the new normal, as in distancing each other and all of that we have done, wearing a mask every time we go out and all of that. And to talk more about it, and in particular with regards to the number of deaths Sri Lanka has had over the last year, we're looking at 527 as at yesterday on COVID related deaths. A lot of people pin it down to diabetes. So is it something COVID is taking control of, or is it something that is due to a different medical situation? We're going to talk about why diabetes had played such a big part in this, and with regards to the vaccination that's taking place around the country, especially in the hotspots. And in Colombo and suburbs, we have seen a lot of it happening over the last month or so. So is it something diabetes patients should take or shouldn't take? And to talk more about this, we have got an expert in the studios with us. It's time for me to say good evening to Dr. Noel Somasundaram, who is the consultant endocrinologist, diabetes and hormone center. Good evening to you, doctor.
Good evening.
Doctor, to start off with before we get into diabetes as such, let us have an overview as to what COVID-19 is and what's the situation right now.
Yeah, so if you look at the pandemic, we seem to be in a nice scenario right now with control measures taking place right across the world. Numbers are falling. So we seem to be in a nice spot right now where most worldwide numbers are coming down all across the world. Although there are some concerns across the world, particularly in Europe, it's still a good scenario. The number of deaths have started coming down, which is a very nice thing to see across the world once again. In Sri Lanka, though, we have got a different scenario. Although the world has struggled, we have somehow got our measures right from the beginning. Despite the second wave and large number of cases, our death rates have remained low. Although we would have liked to have had the death rates much lower than that, the infectivity and the number of people who would get it seem to have been much lower than what we thought it initially, and that seems to be a good scenario to have. So we are in a nice spot right now. Vaccination, as you said, is happening in the hotspots, particularly in the western province. The high risk people are being vaccinated, and as more vaccine will become available, the government will start vaccinating more and more people and across the other geographical areas. So we need to continue to exercise caution and continue to use preventive measures. Even those who have vaccinated will need to continue to have the preventive measures, but we seem to be in a good scenario.
And doctor, talking about this whole coronavirus, because this is something that's been there. It's just that this new wave that started in late 2019 and moving into 2020, what they call novel coronavirus. There are 7 strains to this, and we have just seen this in the second wave that a new strain came into Sri Lanka. How many of such is available right now in the country?
Yeah, so any of these viruses can keep mutating. So there could be actually be hundreds of strains as such. What we are talking about are the more dominant ones. So there are the mainly spoken about ones are what is called the UK or the Kent strain, called the 117 strain because of its nature of the antigen. There is also what is called the Brazilian strain because it's dominant in Brazil and has now spread across the world and is also seen in many other countries. And we also have what is called the South African strain. These 3 we speak about mainly because the Kent strain or the UK strain and the South African strain have been detected in Sri Lanka, but not out in the population, only in localized containment centers or in isolation units where people have been quarantined, and in them it had been found. So we don't have evidence of them spreading, although these 3 strains have the capability to spread faster, and there has been noted in other countries. We Sri Lankans have behaved differently. So whether it will spread faster in Sri Lanka, we don't know, although government is taking extreme caution with regard to these strains. The worrying thing is they are not just their rapid spread and low dose requirement to infect, but also the higher death rate that has been caused. And also with the South African strain, at least from one study, it has been shown that the vaccine effectivity may not be so good. So, if the measures would be to prevent it from coming to Sri Lanka and spreading, and that is why quarantine measures need to continue.
And that's something that the government
Yes,
has done quite a
that's
good
right.
job with. And moving from that, doctor, something that a lot of people have spoken a lot about in Sri Lanka with the COVID related deaths is diabetes relation. What's the connection between the two?
So, right at the beginning of the COVID, what we've seen is that if there is diabetes, the COVID related morbidity, that is the degree of severity of the illness, as well as the mortality, that is the number of people who would die, was much higher. And that is partly because diabetes already is a hyper inflammatory condition, where the body is at war with itself with high inflammatory markers, cytokines and other substances that could damage the body. And even in COVID, the damage is by a cytokine storm, release of abnormal substances that cause damage to the body. So, I think the problem that science has discovered is that COVID itself is a cytokine release mechanism that is causing the deadly features of COVID, and then when it comes on top of diabetes, which is also an inflammatory condition, then these two combined together becomes lethal in patients. Particularly in uncontrolled diabetics, it becomes a problem. So, that is why right from the beginning diabetes had been focused on as a high risk group, along with other high risk people like those with respiratory illnesses like asthma or severe lung conditions, those with kidney diseases, etc. Those who have severe diseases and diabetics were the ones who had higher risk of having complications of COVID.
So, doctor, looking at what we have gone through the last maybe 12 to 15 months or so in Sri Lanka, where the death rate, as you said, have been controlled, but most of it have been related to diabetes or diabetes patients. Is there a particular age group that has got affected the most? Because a lot of people talk about elders getting affected and they are the ones who are most vulnerable. Yes. Is it common to diabetes patients also?
Yes. So, the other independent risk factor to all of these risk factors I spoke about is the age itself, because more than 70 and when it is more than 80, the risk of dying or the mortality risk of COVID is much higher, and that have been seen in many populations across the world. Luckily, we haven't seen that, partly because our elderly people don't reside in one location. They are not in nursing homes, they are in private homes, where we have probably looked after them pretty well, as in private citizens have looked after their elderly pretty well. So, our death rate in that society and that sector of population had been not so high, although it's been there. So, when diabetes is there and other cardiovascular risk factors are there in that elderly population, then also the risk can be much higher.
So, looking at the numbers here now, since we have spoken about it, looking at getting the vaccine, are they the first preference when it comes to getting the vaccine done?
Yes. So, they are the elderly, more than 70 are the people who are high priority for the vaccine, as well as those with non-communicable diseases. The ones that I listed, diabetes and other non-communicable diseases, should get their vaccine first, and that's been the government policy throughout. There are one or two groups of people who should first consult a doctor before they get their vaccine, but otherwise most people can just walk into a vaccination center and get their vaccine. And the ones who need to talk about their vaccination are the ones who are immunosuppressed. Now, when I say immunosuppressed, their blood counts are actually low. Those are the groups of patients who are on cancer therapy and their counts are low, not just any cancer therapy, but actually cancer, the counts are low, or they are on they have had a transplant, like a kidney transplant, and their cell counts are low. So, these two groups of people, despite having despite being high risk, might have to get their clearance from a doctor, because the vaccine might not work in them at certain points, particularly when the cell count is low. But when the cell counts have come up, they can get their vaccine. Still they are at high risk of COVID, so they need their vaccine, but we need to just time it right. So, they need to have a chat with their doctor before they get the vaccine.
One more thing that doctor, a lot of people talk about is whether the vaccine is good or whether it's something that we shouldn't take. A lot of people have discussed about it, and certain people have opted out of taking the vaccine. What's the truth behind it?
Yes. So, whenever any measure is taken, particularly a population measure like that, you always want to think about benefits versus risks. So, when a vaccine, before a vaccine comes, usually there would have been at least 5 years of study. When a pandemic strikes, though, you would realize there is no time to do such long studies. So, we need to do very short term studies before they are implemented. So, that rush is there. If we didn't implement, then the pandemic keeps going, there is no way to crush it. So, we need to make decisions based on the best science available. Doesn't mean that we haven't applied science and haven't looked at the risks and the benefits ratio. So, with all the risk, the vaccines that are available, that science had been carefully been evaluated and is continuing to be evaluated. So, there are two ways to evaluate for the risks. One is, before the vaccine comes, the lab studies are done for their risks, and these, having said that, most of the vaccine technology is standard, and I have had similar vaccines 5 to 6 times in my life, the measles vaccines and all that. Previous pandemic like smallpox had been eliminated with much worse vaccines than this, just a scratch on the skin and allowing it to ulcerate. So, those were very preliminary, very primitive technologies were used on those times. So, compared to those, we are using much more sophisticated technology. So, then came the clinical studies, which have used 40 to 50,000 individuals to show that they actually work. If they work in even 50 to 60% of people, it was good enough. Most vaccines were working in even 70% or more people. We then use surveillance after the vaccine is given, and the particular type of vaccine that we use, that comes, the Covishield, had been followed up by the Oxford University in UK, and they have looked at about 7 million people, and we know that it's pretty safe, and there have been no serious adverse events, no deaths, no serious adverse events other than 1 or 2 serious allergies, and no deaths, which is reassuring. And they also show that in that 7 million people who were vaccinated, the prevention was as high as 90%. The vaccination to work also gives herd immunity. That is, when each one is vaccinated, it prevents it crushes the pandemic. So, that way it offers much more prevention than what each individual gets also, because when we all get vaccinated together, it gives us a herd immunity as a population. So, that way the vaccine has works much more than that. So, in communities like Israel, where they have had more than 30 to 40% who have been vaccinated fully, it is already showing that the population COVID rates are going down dramatically. UK is beginning to show that rate, that their population rates of COVID is going down without much adverse events, although there could be 1 or 2. There is still a bit of caution and concern that may arise, which is necessary for all of our safety. Those questions will be asked. For example, now there is a question in Europe about this Covishield or similar version from UK about whether it causes thrombosis. The verdict from Oxford is that it doesn't cause, but such questions are needed, otherwise we will just be blindly taking. Having said that, I have taken my first dose 6 weeks ago, and I am waiting to take my second dose in another month, and I will be taking my dose. But I have looked at the data, and I am pretty sure that it's safe. We will continue to have these surveillance mechanisms and discussions, and these vaccines are pretty safe.
And doctor, you mentioned that allergies is something that worries, and that's something everyone who's probably looking at taking the vaccine should keep in mind, and to consult their doctors with regards to if they do have an allergy. What are the main ones that they should avoid?
Right. So most people in the modern world have some form of allergy. So we are not talking about those allergies. So most people worry that they have penicillin allergy and NSAID allergy and aspirin allergy and so on. So we are not talking about those allergies. We are only talking about, are you allergic to a component of the vaccine composition. So the vaccine is composed of inactivated virus, and we are most likely not exposed, and that's why they say if you have had COVID before, don't wait for about a month or two before you have your vaccine, because even those who had COVID need to have. If you have it too soon, you might have a serious reaction. So that's the most amount of reaction you might get. Otherwise, most of the reaction happens with the first dose, which we are not aware of. So if those who have serious allergy, that is unknown allergy, and they get anaphylaxis, that is they lose consciousness and are difficult to, and they find it difficult to breathe for unknown reasons, that kind of person should take the vaccine in a well-known place with resuscitation facilities. Otherwise, if you are just allergic to something like me, then there is no concern, because the only concern about the vaccine is whether you are allergic to some component within, not any allergy.
All right, doctor. And getting to the vaccine itself, a lot of people who have taken the vaccine have complained about fever and
Yes.
body pains and aches and all of that. What's resulting this?
Yeah, so the vaccine that we get is actually an inactivated virus. So what it does is, we need the body to be presented with thousands or millions of copies of the coronavirus itself, and the body need to recognize that surface antigen and produce antibody and cellular mechanisms to cope with that infection for future. So what we are doing is actually producing a scenario similar to a COVID infection without actually being infected by that. So inactivated virus which replicates in the cells and gives signal to the body saying, look at these antigens that are there, and that process can, in about 30% of people, give a flu, which can present as aches and pains, malaise, fever, diarrhea, cough sometimes, and severe aches and pains, sometimes severe. No, don't worry is our message, because for most of the vaccines to work, that has to happen. So whether you take a measles vaccine, a chickenpox vaccine, a rubella vaccine, a reaction, a flu for 3 days is something that is expected in about 20 to 30% of people. It is natural. When we had the smallpox vaccine, they put a scratch and put the vaccine, and then we had a large blister. I don't know whether people remember, for the last pandemic in the 1970s, and that was the way, along with the flu, that the vaccine gave the antibodies in the blood. And then when the whole population in the world got vaccinated, the virus went away, because there was no host for the virus to multiply in. And the same process will happen. Flu is a natural reaction by the body, whichever brand of vaccine you take.
So with regards to having fever or body pains, doctor, is it okay for these people to take something like paracetamol or for any other medicine after taking the vaccine?
Of course, we can just behave as if we had had a flu, take plenty of fluid, take a rest, paracetamol, if they need it, and rest, and it will go away in 2 or 3 days.
All right. Now moving on to the real subject of diabetes, doctor. So a diabetes patient is someone who is probably in the first in the line, if I may call it, to take the vaccine. But once they do so, can they still continue to take their medication with regards to diabetes, and how would that affect?
Of course, they should continue their diabetes control. Even if they had their vaccine, they need to control their control their diabetes. And I must also remind that the best defense for COVID is to have perfectly controlled diabetes, whether they are normally living, whether they are exposed to COVID, even if they have COVID-19 infection. It's imperative that diabetes is controlled well, even to get better from that. So at no point should they stop their medications, even if they had flu.
Because this is something that people always say, that when they have fever and all of that,
Yes.
they tend to give up on a certain medication just to probably try and get better with fever or body pains and body aches and all of that they go through. Is it something that people need to worry about, or it's just that they need to take control and stay calm and make sure that they take the medication on time?
Yeah. So diabetics must remember there is what is called sick day rules for diabetes. So for most of the diabetic patients, because there is additional stress involved, that the illness brings on additional catecholamines, cortisols and other bad hormones that will raise the glucose, normally the blood glucose goes up. It happens for most of the patients. Even if they don't eat, the glucose goes up. So we recommend that you continue the medication as usual. Most people, when they are, even if they are not eating, they should monitor their glucose and continue. And sometimes they may actually need more medication than usual. And so it's not a good idea to stop the medication.
And doctor, talking about all of this, so what we say is, as a message, is to make sure that you get yourself vaccinated and to continue a medication and stay in a healthy lifestyle as much as possible. But a lot of people tend to forget what their core requirement is. As soon as they get a vaccine, they think, okay, in a couple of days time,
Yes.
I'll be back to normal. Is this a misconception, or people just feel that they'll be all right? And even things like wearing the mask, they feel once they get the vaccination, all right, okay, I should be all right. Is that something that they should get into, or they should follow the rules as it is?
Yeah, so there is a reputed journal called Nature, and in that they have studied, they have tried to analyze what will be the next course of COVID for the next few years. We don't know, but they've tried to forecast. So they say that the most likely scenario is that COVID is there to stay at least for 5 years, because we are not going to be able to vaccinate the 100% of the 7 billion population of the world, and it's there to stay. So vaccination is one step, and still we'll have waves, and the best communities that will come out of it victorious will be the ones who will do all of these simultaneously right throughout for the next few years. That is, wearing the masks and using the basic principles of physical distancing, contact tracing, and keeping those social rules and norms at best, and then continuing their business as usual method, and vaccination of the population as much as possible. We might have to do this vaccination 5 to 6 times more until it goes away, unlike in the past pandemics where smallpox only one vaccine dose was required. This is a bit more difficult than that. So we need to remember to keep doing all of that, because even after vaccine, only 90% protection is offered. 10% chance of getting infected or giving to another is possible. So we need to use all those precautions. Although we are safer, we are not 100% safe, and that all that is required.
Thank you very much, doctor. I think that's something for everyone to keep in mind. As doctor says, try and stay within the boundaries that's given by the government and the health authorities, because this is here to stay, and we need to make sure that our society stays safe and away from COVID as much as possible. I'd like to thank Dr. Noel for being with us and sharing your expertise, doctor. It's time for me to say goodbyes on today's edition of iMed. See you same time, same place next week as well. It's bye-bye from me.
you.